MIST, or Minimally Invasive Sinus Techniques, represents a groundbreaking approach in sinus surgery. Developed in the late 1990s, MIST was the first true minimally invasive sinus procedure, with a clear beginning and end to guide surgeons, ensuring a more precise and efficient operation. MIST is unique in several ways. First, it follows a step-by-step anatomical progression, giving surgeons a defined path to follow, similar to other structured surgeries. This makes MIST a consistent, repeatable procedure where surgeons know exactly when to stop. Unlike Fess, MIST provides a clear and reproducible process, meaning that if someone has had a MIST procedure, it's well understood exactly what was done. This level of consistency is rare in sinus surgery. MIST specifically targets sinus transition areas, like the ethmoidal infundibulum and the frontal recess, without exposing any bones. By preserving all sinus ostia and mucosa, even diseased tissue has a chance for reversibility and healing. Surgical innovations. MIST minimizes the use of forceps, replacing them with a microdebrider, a precision tool that cuts tissue and suctions in real time. This allows for more accurate tissue removal without damaging surrounding structures. The procedure doesn't require nasal packing, septal splints, or sutures, and avoids the need for postoperative debridement. MIST also preserves the middle turbinates, contributing to less postoperative discomfort and better outcomes. MIST differs from Fess in its patient-centered philosophy. Rather than operating based solely on CT images, MIST addresses actual patient symptoms. In the first 2003 study comparing 100 patients treated with MIST to 100 with Fess, MIST showed lower morbidity and a revision rate of only 6%, with long-lasting outcomes. Essentially, if Fess had been performed initially, 94% of patients would have undergone a more invasive, unnecessary operation. In 2004, research by Albu and Temescu reinforced MIST's advantages. They found that expanding the maxillary sinus opening didn't impact outcomes for chronic maxillary sinusitis, suggesting that extensive sinus openings, as often done in Fess, are unnecessary. MIST, by contrast, achieves the same results with a smaller, more targeted approach. For most patients with inflammatory sinus disease, MIST should be the primary choice. It's a procedure designed to perform the minimum required to restore sinus function, leaving structures intact. Only in specific cases, such as fungal sinusitis or inverted papilloma removal, might an alternative approach, like maxillary sinus antrostomy, be necessary. In summary, MIST represents a true advancement in sinus surgery, focusing on precision, patient outcomes, and targeted treatment. Its minimal approach, preserving natural anatomy while addressing symptoms effectively, makes it a clear choice over more invasive methods like Fess.